Hi guys, welcome back. My name is Alexis and I am a registered nurse. So today we'll be talking about breast cancer. Yes. And I would love to ask you a question. When was the last time you checked your breast? When was the last time you examined your breast? Or have you felt a lump in your breast before and then you feel it's normal? If so, then stay tuned. This video is breast cancer is one of the most common cancers in women, and the scariest part of it is it can just appear as a lump and then it stays there for years and you think it's normal. Well, in some cases you hear people say, I did not know that it was there. I didn't think to check. Yeah, and guys, guess what? It's already stage 3 cancer. Why? Because it was not detected early. So please, if you notice you're having a lump in your breast and you don't know what it is, do not take it lightly. You need to perform a breast self-examination. This starts when there is an abnormal cell in your breast and then it turns into a lump that can spread if not detected early. And there are signs you need to watch out for. Yes, you need to watch out for nipple discharge. That's when you pinch your nipple and then you see discharge, little discharge. You need to pay attention to that. Another one is skin dimpling. I'm sure we know how the peel of an orange looks like exactly. You notice your breast is like that. Pay attention to that. Another one is breast pain. Pay attention to it also. But the thing about this is you do not have to wait to have all the signs to know. Because I've also heard some people say, oh, I only noticed pain. Someone say, oh, I only saw the lump and I thought it was normal. No, you do not have to wait until you're having all the signs. If you notice one abnormal thing about your breast, you need to pay attention to it. And you also need to pay attention to the self. Here is a picture representation for the breast self-examination. And we have 5 steps. The first step is to look in the mirror. So what we do here is you have to look at your breast with your arms at your side. So what are the things to check out for? You're checking for changes in the size, shape, color, or symmetry of your breast. And you're also to look out for dimpling. Remember what I said when I talked about the peel, the skin of an orange? Yes, skin, breast dimpling. And you also to look out for swelling or changes in the nipple. That's for step 1. Now for step 2. For step 2, you have to raise your arm above your head, okay? And also do it while you're still looking in the mirror. And you have to check for the same thing you checked for in step 1. Next, we have step 3. Now, step 3 is done when you're standing underneath the shower. You do that while you're standing. So what we do is, using the pads of your 3 middle fingers, use a circular motion to feel your entire breast, including the underarm, that's your armpit. You notice any lump or hard mass there, be sure to inform your healthcare provider. Now for step 4 is done while you're lying down. So you check while you're lying down. So what we do here is you lie down and place a pillow under your shoulder. Use the pad of your 3 middle fingers with light, medium, and firm pressure in a circular motion to check your entire breast. That's for step 4. Now for step 5, you have to check your nipple. Very important. Now, what you do is you squeeze your nipple, each nipple, you have to squeeze it to check for discharge. Be it bloody, be it clear. Pay attention to it and inform your healthcare provider. Very important, please. And you're also to know the color and the consistency. Early detection can save lives. Remember, knowing your breast can save your life or save the life of someone else you love. Okay? Spread this video and please help create awareness. Thank you.